Hey everyone, it's Dr. Good at VSI. I'm really excited to introduce y'all to our new Hyperbaric Oxygen Therapy program. Really excited to bring this to VSI and incorporate it as part of our recovery revolution. We're really trying to do everything we can to help people recover from injuries, as well as recover from things like surgery or stem cell regenerative medicine procedures. I'm really excited about the hyperbaric oxygen. It's a procedure that helps us deliver hyper concentrated oxygen to your tissues. So when you're trying to heal, having good oxygen to your tissues is a big part of healing from injuries and from surgeries. And so this is going to be a huge benefit. So I'm going to do a little video here to take you along. If you want to listen, welcome. I'm about to go in for some hyperbaric oxygen therapy, and so I invited you to come along, see what the experience is like, and get an idea of what it's like to go through this. So I'm at the chamber now. I'm just getting started. I'm going to go put on my cotton clothes, and we'll be checking in just a second. Let's go. All right, we're about to start with the hyperbaric oxygen treatment. I'm going to go through each of the phases so anybody who's coming in to have this knows a little bit what it's like ahead of time. So I'm here. We're in physical therapy, so there's a bunch of people around, like doing their PT exercises or whatnot. There's the chamber that we're going to be going in. So there's just a quick health questionnaire we fill out every time, just to update. Make sure we know what's going on with people, and then next chaired in here is going to be checking my blood pressure and my oxygen level, which we do just to make sure everybody's got good vital signs before going in for their treatment. All right, everybody, I passed my blood pressure check. I want to give you a little introduction, show you around the hyperbaric chamber before we go in so that you can kind of see a little bit about what's going on. So as we come over, you can see the chamber. It's got a nice big door and actually a ton of space inside so we can see. And I'll just show a little bit about what's going on. We've got this metal chamber, very, very thick and powerful. And so what we'll be doing is we'll be building up increased pressure in there as compared to the atmospheric pressure around us. It's all controlled through this touch screen here. You can see we actually control how long we're going to be going in the chamber. And then we can control here, we can see what the temperature and the humidity is around us. And then over here, we could see what the percentage of the oxygen is. So 21% is like the percentage of oxygen in the air we normally breathe. In the chamber, we're going to see that air pressure, that percentage of oxygen go up. And then this is how many kilopascals, what our pressure is above room air, atmospheric pressure. So we're going to be going to about 100 kilopascals, which is going to be basically 2 times normal pressure in the environment around us. And so there's a phone here. So I can call if I'm on the outside. You hear it ringing in there, and so the person who's in there can talk out. And so once the chamber is closed, we use this to communicate if we need. There is an intercom button there. And then there's on the inside and the outside chamber, there's some manual controls as well. We obviously control all this with a touch screen, but there is a control so that you can slowly decrease the pressure in the chamber, so that when you turn the chamber off and it quits pumping, it'll naturally decrease slowly. And anytime we change the pressure, we want to go up or down slowly. But there is a way to manually change that if we need to go a little bit faster to get people out. Now, we don't want to be getting in and out of a pressurized chamber very, very quickly, right? We've heard of like divers, deep sea divers getting the bends because they go from very high pressure to low pressure if they come up too soon. And what that is like little bubbles of nitrogen building up in the bloodstream. So it's the same thing. Like if we're going to do this for an hour, we're going to spend about 15 or 20 minutes slowly building up the pressure, like when you go up in the airplane and your ears pop. Then we're going to be at the pressure, and at the end we're going to slowly decrease, just like a diver coming up from a deep sea dive. And so we do want to make sure we follow the right protocols for that. If we were to suddenly like open and get out all of a sudden, then that could cause a rapid depressurization. It could damage your ears or other things. So we would never do that. So we're about to start. I'm going to be going in for an hour. And so Sheridan is here. He's going to be helping me to like go through. And so if you look at how it works, there's a glass door that slides. And so once it goes in, the door just slides back and forth. But as the pressure builds up inside the chamber, it will actually push that door closed, and you'll feel it get a seal. Okay, so we're gonna go in. We wanna be wearing like cotton clothing, and we always want socks on so everything's nice and clean. We're not wearing any makeup or any hairspray or anything, just to try and get the optimal effects of the treatment. Okay, and so I'm going to go ahead and show you the door there. It's pretty easy to get into, but you do have to bend your head down a little bit, but there's a couple of handles to grab a hold of. And so I'm going to go ahead and like come right in the chamber. And so you can see there's a really nice like airline recliner chair. And then we also have a bed that we can lay down in. And so if I try and give you an idea on the inside, there's a good amount of space. We could fit like, 5 of me in here if we really needed to. I can't quite stand up, but there's a lot of overhead space. So it's not really tight. I think if somebody had like really bad claustrophobia, maybe they wouldn't want to do hyperbaric, but um, for most people who don't have major issues with that, I think it's kind of a non-issue. So let me show you around inside the chamber. What patients like best is this. So we got the big screen TV. You can go ahead and put on a movie, watch TV while you're in here. And so that is definitely a nice way. You can also turn off the lights, and it's a remarkably like nice place to like be present and mindful, or even do some meditation. Obviously, some people are doing reading, work, or whatever it is that we want to in here. Now, if we look at the door, so either I or the person who's helping me, the door is going to just slide closed. Okay, so the whole time we're in there, we can see everybody outside, and they can see us. Although once we turn the light on, if we want, they don't really see in very much. And that allows us to communicate. Now, right now, I can put my finger, if I wanted to, in between the door here. As the pressure builds up in the chamber, it will actually push this door out. That's what creates the vacuum. So the door won't slide open when there's a pressure in here, because we would have a rapid depressurization, which is no good. Okay. Now, again, we talk about always like how things work. And the first time you come in, you don't want to be pushing all these buttons, but so you could see what they're seeing out there. So you could see we're set to go for 60 minutes. We can see right now I'm at 21% oxygen, 0 pressure. And then there's some other things here. There's air conditioning. I can turn it off. There's the light that goes on and off inside here with me. And then there's this thing that causes an ionizer. It like ionizes the air that is in with us. Okay. And we'll be doing our trip. We're going to be going up to 2 ATA. Now, on this side, you can see there's a couple little nozzles. So that's where air cannulas are going to go. You can either put your typical nasal cannula, or you can put a face mask on. Both are totally fine, and it is a little bit of a matter of like preference and comfort. I personally breathe through my mouth a lot, and so when I do it, I normally will actually prefer to wear the face mask, because that way the oxygen that's coming in goes in through my nose and my mouth, and I know I'm getting a good concentration of oxygen the whole time. Although some people really like more the nasal cannula, which is the kind of the standard thing people have seen in the hospital or in TV. So you put that on, and it's going in your nose. Now, if you breathe only through your nose, you get great oxygen. If you breathe only through your mouth, you get less oxygen. So that is something to keep in mind. I'll wear this one today just for the purposes of like doing a video during my treatment. Although again, I do, the face mask does give a little bit more oxygen, so that's the one I usually prefer. Now, if you think about what's going on, this chamber has 21% oxygen in it right now, which is what room air is. As we go under pressurization, the percentage of oxygen will go up in the chamber to like around 50%. But I'm going to be breathing 95% oxygen, so like almost pure oxygen through the nasal cannula. All right, so the purpose, and we'll talk a little bit more, but the purpose of a hyperbaric chamber is to increase the amount of oxygen inside your bloodstream that can be delivered to your body. So normally we breathe oxygen from the air, 21% oxygen, and that goes through our lungs into our bloodstream. And the oxygen is actually carried by hemoglobin. Okay, those are the cells in the red blood cell. In the red blood cells, the hemoglobin carries the oxygen, but hemoglobin can only carry so much oxygen. And so most of us, our hemoglobin is pretty much full of oxygen. It's maximally carrying oxygen almost all the time, right? And that's why you go to the doctor, they check your oxygen level, and most of us will read 96, 98%, which means our hemoglobin is 98% full. So most of us are already like getting as much oxygen as we can. The benefit of the hyperbaric chamber is not only do we breathe more oxygen in the environment around us, which can bump us up a little to fill our hemoglobin, but having the increased pressure around us presses more oxygen, not just into this red blood cells, but also into the plasma, right? The liquid around the blood cells. So overall, your bloodstream is carrying a lot more oxygen in this environment. And so the goal is anytime we want to deliver more oxygen to tissues, which can be really important for a variety of medical conditions or healing, this gives us a real way to get super concentrated oxygen delivered through the plasma, not just the hemoglobin, into the tissue. So a little more on that later as I'm doing another video. They're out there watching me talk and ready to get started. One other thing I did want to show, though, is if we come over, there is an air conditioning unit. There's not a lot you have to know there, and there is a remote control. And so really all you want to do there is if you want the air conditioning on, you can just do temperature up or fan up or down. There's a lot of other settings on there. Just leave them alone would be my thought on that. And then if we sit in the chair, I want to go to the safety valves. There's two valves that basically we're never planning to use, but when we decompress the chamber at the end, we're going to be turning this valve very slightly to let a little bit of air out. And we're only going to let a little bit of air out a minute so that the pressure slowly goes down. In the event of emergency, somebody really wanted to get out, we still have to do that over a number of minutes, but we can go a little bit faster if we need to. And if there were ever to be a true emergency, then there is actually a button you can push, and that goes when you push it, and it would let the air out a bit faster. Now, in our environment, I think it's extremely unlikely to have those kind of things, but hyperbaric is used in some really, really sick patients, people who are things like strokes or heart problems or divers who are very, very sick who've come up from pressure. And so being able and understanding the protocols of getting people in and out of chambers as quickly as possible is really more important in that like environment where we're taking care of really, really sick people. Obviously, not as much when we're, or hopefully at all, when we're talking about utilizing it for people who are in relative good health, who are trying to get good healing from their injuries. And so we're all getting started here. So what I'm going to do is I'm going to go ahead and there's a button right here. That's my intercom button. I'm going to hit that intercom button. It's going to ring out there. So you see. Hey, buddy.
This is your captain. How
Oh,
you doing?
I love it. All right. Are we ready to go? All right. So Sheridan's in charge. He's out there. We're going to go ahead and get started. And he's make sure that this is all closed off. And you see when he turns it on, we'll see the button go to on. And then what we'll do is we'll slowly watch to see that the pressure goes up just a little bit. Okay, right now you see how we're at 1 kilopascal. Now, as soon as the chamber goes on, I'm chilling in here. I would normally have the lights off if it were just me, but since we're doing a video, you'll start to feel your ears get a little bit of pressure, just like you're going in an airplane. And so they talk about chewing gum, or for me, just very lightly depressurizing, just like I do if I'm going snorkeling or something like that. And you're going to do that a good bit in the beginning. And so if we look at what's going on, there's of course the computer screen, and there's the manual dial. But I can see now, here I am, I'm up at 5 kilopascals, and we're seeing the oxygen percentage go up just a teeny bit. So the pressure has started to go up a little bit. We're just getting started on our way. But we also see that the oxygen percentage has started to go up a little bit in the chamber. Now, there are different types of chambers. We chose this chamber because it goes up to a really good pressure, and it allows a lot of oxygen. But it's not there's some chambers that are completely filled with like 100% full pressurized oxygen, which can be even more powerful. We elected to go to this one because it's a really great balance of getting the right amount of oxygen, but by avoiding those higher pressures of pure oxygen, there's a little bit less to operating it, a little bit easier in terms of safety and protocols and all of those things. In a pure 100% oxygen environment, things are more of a concern in terms of like fire risk and a lot more restrictions about what people do in there. Sorry, I'm talking a lot, so I need to decompress a little bit. So if we check back in, okay, we could see we're going up a little bit, right? So we are at 11 and 25. So we're seeing our pressure go up a little bit as we do all that. And really that's kind of it. Over the next, 10, 11 minutes, the pressure will keep going up, and I'm going to watch this go up. And so we're going to get all the way up to 100 kPa, kilopascals. And so again, this chamber is a 2 ATA chamber. So ATA stands for atmospheres absolute. That's the amount of pressure. So if you think about like being right outside at sea level, like that is atmospheric pressure. So we're essentially going up to double what that level of pressure is. We're not like that the whole time we're in the chamber. That's when we're at the maximum, but there is, again, the time to go up and the time to go down. Now, I think anybody I think it's the first time people get in, it's normal to be a teeny bit nervous. Although once you get in and you're kind of chilling in this really nice environment, it's no big deal. But it's also like be communicating. We've got the intercom, and so it's also really important. Make sure like you go to the bathroom right before you come in because we are planning to be in here for an hour, and it does take a little time if you decide you want to get out early to get it depressurized. So make sure you take care of that beforehand. Um, I'm going to go ahead and sign off for a second now. We've been doing kind of a long video here, so we can pick back up. I'll give you an update as our pressure starts to go up a little bit and we get a little bit further along in the process. Hey, it's Dr. Good. Just chatting a little bit as I'm undergoing a hyperbaric oxygen treatment here at VSI. A treatment's been around for a long time, but something I'm really excited to be able to offer to our patients as it relates to healing from surgical procedures, recovering from injuries, or regenerative medicine. So, HBOT, hyperbaric oxygen therapy, HBOT, is the goal of all this is just to deliver more oxygen to our tissues, right? Now, we all know you breathe air in, it goes to the lungs end up getting it into the bloodstream, which carries it around the body, and we know oxygen is important for a lot of functions. Excuse me, I'm depressurizing a little bit as the pressure goes up. Now, we know that oxygen delivered to our body is very, very important, right? A lack of oxygen is what causes a stroke or a heart attack. And there are some medical conditions that jeopardize our ability to have oxygen in our bloodstream. People who have diabetes, smoking, nicotine, a lot of these things can actually jeopardize small blood vessels. And the lack of those little blood vessels means that we're not nourishing our tissues with oxygen, and it leads to problems. Things like peripheral neuropathy, diabetic ulcers, stroke, heart attack, etc. And so the goal of wearing oxygen is to get a little bit more oxygen in your bloodstream. In our bloodstream, most of the oxygen is carried by our red blood cells, called in what's called hemoglobin. But the issue is our hemoglobin only holds a certain amount of oxygen, and actually most of the time our hemoglobin is pretty much full of oxygen, so it's kind of already transporting as much as it can, right? It's like the train is already full and there's almost space for no more passengers in there. The goal of hyperbaric oxygen is not only to breathe in some oxygen, but by increasing the pressure around us, it actually drives more oxygen into the plasma, the liquid around the blood, if you will. And so once the train is full, this is like putting extra cars on the track so more can go. And this can actually increase the percentage of oxygen in our blood like big time, like 200, 300%. Exactly how much depends on the percentage of the oxygen you breathe and the pressure of the hyperbaric tank that you're in. But the whole point is to increase oxygen delivery to our tissues. Now, why would I want to do this, right? Like, I'm a 49-year-old spine surgeon. Like, there are a number of potential benefits that someone might want to do this. And anytime where getting more oxygen to our tissues is a priority. So, one obvious one is anytime we're trying to repair tissues, right? So, if someone has had a surgery, they have an incision, they have a wound, we're trying to get a wound to heal, that is one of the earliest and most well-established benefits. In fact, even as a high school kid, I saw my grandpa when he was in his 90s almost cut his thumb off. It get gangrene. He almost lost the thumb, and yet in a high power hyperbaric chamber, they were actually able to completely heal him and save his thumb. And that really relates primarily to the oxygen delivery. Now, um, the hyperbaric chamber does stimulate growth of new blood vessels. They call that angiogenesis. And so the more of these little micro blood vessels we have nourishing our bodies, the better we're delivering oxygen and the better we're healing for things. And that's exactly where medical conditions, the ones I always use are diabetes and smoking, but there are others, things that kill little blood vessels, decrease the nourishment of our bodies with oxygen and lead to problems. And so if we look at people who have disc issues in their back or arthritis or peripheral neuropathy, many times that's because the small blood vessels that nourish those structures have been jeopardized by one medical condition or another. Now, another reason we may want to consider a hyperbaric is to reduce inflammation. Now, inflammation gets a bad name. There's good inflammation and there's bad inflammation, and inflammation is a normal part of our body's healing process, right? Our immune system functions on inflammation. So, anybody who's ever gotten bit by a mosquito and had a little bit of swelling or redness knows a little bit about inflammation. There are some times when our body's inflammatory process gets out of whack or it overreacts, and so our body's immune system can actually do damage to our own tissues. And there are times when, for a variety of reasons, somebody's body gets kicked into overdrive with inflammation, and too much inflammation can be bad. And so hyperbaric oxygen can decrease some of inflammatory markers. So actually blood tests that we can do that show inflammation, and then blood tests we could do that show using hyperbaric can actually help to decrease some of those. And so using those biomarkers, we can prove it's actually achieving some of the desired results we're going after. All right, everybody, it's Dr. Good again. It's been a few more minutes, so I'm just doing a check-in. I'm chilling in the chair. I still have the light on. We are now, let me go over to the thing so we can see where we're at here. So we are at 30 kilopascals, and I'm at 37% O2. I can see my timer is telling me I've got 50 minutes left in the chamber. So I've got a ways to go. I'm kind of halfway up in terms of my pressure. I've been chilling. I have had to decompress maybe 10 times over the last 10 minutes. Anytime I feel like my ears are building up a little pressure, I just decompress a little bit. And I'm not trying to hyper breathe, but I'm like taking a few deep breaths through my nose, although mainly I'm talking through my mouth because I'm doing all these videos. So I think a lot of people who would be more focused on this. So I don't have anything up on the TV right now, but that gives you a relative idea of like how far away we are from the chamber. And there is a pretty good amount of space in here, right? So I think the chamber is built for more than one person to be able to be in here. And if you look at the bed and the amount of space we have, like there's a good amount. I was actually doing some push-ups the last time I was in here and some crunches, just to kind of get an idea. And it is a super comfortable environment. So that's kind of it. Like I look outside, I give a thumbs up to Sheridan out there, so he's kind of keeping an eye on me. The person who's assisting you in the chamber is most involved kind of right in the beginning and right in the end. So when you first go in, they're watching, and the chamber automatically slowly increases the pressure. So they're not really doing anything manual out there other than just keeping an eye to make sure it's going up to the right level. Now, when the chamber automatically turns off, meaning it quits increasing the pressure in here, the chamber will naturally dwindle down. But the person who's helping with the chamber can turn the dial a little bit if the chamber's not naturally decompressing, because we want to get out. Like once we're done, it's like, okay, let's get on with it. So over about the last time I did 10 minutes, sometimes 15 minutes, we'll slowly decompress. Now, the faster you go up or the faster you go down, the more you may have to decompress. And so we do want to make sure we keep that as comfortable as possible. If someone were to just open the valve and get out immediately, that would be like a massive rapid decompression. In fact, if you were to just suddenly open everything, you could pop an eardrum or have like a really bad decompression illness. You could even, in fact, you could get the bends, which is just like a diver coming up from depth with the nitrogen bubbles in the blood. Actually, this is used to treat people who've had that happen, but you could actually artificially create that if you were to suddenly turn this off and just hop out. So, well, like I think it's very, very safe, and I pretty much enjoy my time in here. It is something where we do want to learn a little bit about the things to do and not do, and make sure everybody's really comfortable while they're in here. Okay, sorry, back again. I just want to do an update video on where I'm at with my pressure. I'm up to 68 kilopascals, so we're getting there. 42% oxygen inside the chamber. So that means there's 95% oxygen coming into my nose. But then the chamber is also gone from like 21% oxygen, which means 21% of the air is oxygen. That's room air, like normal air we breathe. It's gone up to about 43%. So we were talking a little bit about why someone might want to do hyperbaric, or what the potential benefits are. You can see, sorry, out the window there if people are walking by. We talked a little bit about enhancing tissue repair, talked a little bit about reducing inflammation. some other benefits of hyperbaric oxygen use. One is to improve your body's immune response. So actually increasing the function of our white blood cells. So inside our bloodstream and our bodies, the white blood cells are the ones that are actually in there, like fighting infection. And so hyperbaric air can increase the function of our white blood cells. And if someone were to have an infection, especially an anaerobic infection, those are bacteria that don't like to be surrounded by air. Actually, hyperbaric oxygen treatment can be super helpful. Now, there's other benefits, and we're seeing a lot of excitement in the world of the longevity space. People talking about hyperbaric effect as it would relate to telomere length and longevity. There's also a lot of interest when it comes to neuroplasticity, brain healing, and treatments of things not only like traumatic brain injury or stroke, where the brain did not get enough oxygen, but also things like Alzheimer's, dementia. There's a lot of really excitement in this area, although we'll say a lot of this is new and a lot of work still needs to be done. I mean, the main reason for the excitement is that hyperbaric oxygen it promotes neurogenesis, right? So like the growth of new like neural cells and tissues. And so one of the reasons I'm really excited to be kind of one of the first like orthopedic spine, surgical practices incorporating this, right, is not only to be able to offer it to our patients and improve their outcomes, but also just to really do some studies looking at when this works best, how do we use it best, like how long should you be in, what is the right kind of interval, and which patients get the most benefit out of this. And that's something where I think we have a lot of data for a long time on hyperbaric oxygen. I'm excited to be using it for my own condition. I'll talk about a little bit why I'm in here. It's not just for fun. But I think from there, it's very intuitive to think there are lots of conditions that decrease blood supply to our bodies and cause medical problems. And there's a lot of times when we want to increase blood supply to treat those medical problems, and hyperbaric oxygen can be a really important tool in that. I think if you look at why VSI, I think most of the hyperbaric chambers are really either in like big medical centers taking care of like pretty significant medical problems, sick patients, bad, wounds that won't heal and feet that are falling off, divers, people who are very, very sick. Why, our practice really specializes more high level, spine surgery, rehabilitation, injury, stem cell treatment, regenerative medicine. Well, for us, I think a big part of it is post-surgical recovery. Like we know that if people have surgery, there's stress on the body, there's wounds that have to heal, there's incisions, there's muscles that need to recover. And I think it's a really awesome tool to be able to use for patients like that. I'll tell you the number one reason I decided, that we were going to do this is from my own experience. I've had a number of orthopedic injuries. I've had stem cells injected into both my shoulders many years ago, thankfully with great results. But last year I ended up having not only a broken tailbone, but some disc issues and irritated nerve in my back. And so I went through a pretty big stem cell procedure, putting stem cells in the discs in my back and around an irritated nerve and in my broken tailbone. And I recovered. Now that's a process that takes a number of months to fully recover, and it's been tremendously helpful. But everything that we did as my team was helping me recover through that, I learned, and I said, what would have been better if I obviously I have access to everything working here, but like what else should we have to make this less painful, faster recovery, easier, et cetera, et cetera. And so as we started looking at this, we've really refined a lot about our recovery protocols, not only in terms of how fast we get in working with the therapists, the things that we can do with massage and laser and ice and different things to help people get through the early phase of the pain faster, getting the aquatic treadmill. But to me, I was looking at this and I say, gosh, like I wish I'd had access to the hyperbaric chamber right when I did my initial stem cells years ago, just to do everything we can to optimize those chances of healing and success. And so I recently had a PRP injection. So that PRP is when you take blood from the vein in your arm, you spin it in a centrifuge to concentrate your own growth factors, and then you inject that PRP, right? And so the goal is you inject those growth factors into an area that's had an injury or damage, and then over a period of time, you're like inducing your body to have another healing response. And so it's part of my process rehabbing from my PRP injection. I'm working with physical therapists. They've got me on sports specific programs. I'm doing some dry needling, some massage. I'm exercising, in a very dedicated way, but I'm also spending, my goal is to spend at least a couple hours a week in the hyperbaric chamber, especially during this critical time healing from my procedure to optimize my chance of recovery. So I think here at VSI, we're really talking about people who've had some kind of procedure they're trying to recover, whether that's any surgical procedure or whether that's a regenerative medicine procedure, a stem cell injection, concentrated marrow, we call mesenchymal stem cells, any patients who are going through that. There's also a lot of interest in terms of athletic performance, right? And so working with high level athletes, pro athletes, but really these days, even our some of our middle school and definitely our high school and collegiate athletes, like unbelievably high level, and these people are playing year round, and so there's a lot that goes into rehabbing them, and so being able to use this to help with muscle recovery, injury healing, and enhancing athletic performance is another really nice benefit for especially for really high level people, and so I'm excited. A lot of people are wanting to get to the chamber more because of it's getting all this attention in the longevity space, right? In terms of the telomere length and mental clarity and function. But for us, I think those are all really exciting as well. But we're really dialed in on making sure the patients that we are treating here at VSI have the optimal recovery routine put together after their procedures. All right, we made it, everybody. So it's Dr. Good, just sharing my hyperbaric treatment with y'all. I've been chilling in here decompressing from time to time. So if you look at where we're at now, I'm at 100 kilopascals, so that's our final pressure. I'm up to 52% oxygen, so I said our goal would be to get to about 50. And I've got 39 minutes remaining. I actually got here a few minutes ago, but I was shooting another video, so I didn't give you an update right when I got there. But I'm going to spend about 40 minutes kind of at 2 ATA. That's that atmosphere is absolute, so double pressure. And honestly, now that I'm really decompressed, like I could decompress a little more, but now I'm kind of just sitting in the chamber, and I guess I feel like I'm talking loud. There's a little whirring noise just from the air in the background. I'm really enjoying the Northern Lights. Everybody knows I'm a huge fan of the Northern Lights, but now it's kind of just chill mode. And so we have this like kind of 30, 40 minutes. And then once it's time to decompress in the last 10 or 15 minutes, then I'll start to feel the pressure change and I'll start to equalize again. But for now, basically just chilling, getting a little bit of work done, a little shut-eye, watching a movie, whatever it is that you want to do in this environment. So I'll check in with you again as we get down to the other side and we get ready for the depressurization. All right, I'm in my last 10 minutes of my hyperbaric oxygen treatment here at VSI. So what that means, I was up at the 100 kilopascals, and now in the last 10 to 15 minutes, the machine is turned off. So it's not actually pumping more pressure or oxygen in right now. And then the pressure in the chamber is slowly going down. So my ears are naturally kind of popping. I'm not needing to depressurize like yawning and like blowing into my nose. Like I kind of felt the need as the pressure was increasing. It's going down a little bit more naturally, but I do feel a little like crickle crackle going on in my ears. So if you look at where we're at right now, so we're at 74, just on our way down, and then I'm at 44%. So as it stops pumping oxygen in, we're going to see this go from the 50s down to room air again at the 20s, and we'll slowly see this going down. So we're kind of thinking like, maybe like 9 kilopascals a minute, so it's going to take between 10 to 15 minutes, depending on how fast. I've done this a few times since I started this a week ago, and I find like I depressurize really like pretty well. So I told them they can go ahead and basically the machine will kind of naturally do this pretty steady pace over the first like 7 or 8 minutes, and the last few minutes it'll kind of stay there. So that's when they'll open the valve up a little bit to get me all the way down. And as the pressure naturally dissipates, as the pressure goes down, this door will just naturally sink in, and I'll be able to slide it open once the pressure is there, and we're all done. And so I feel like a little extra energy. I definitely feel like maybe I'm talking a little louder than I might be. The first time I did this, I went out and we had a whole meeting with the team about the process and what it was like, and I definitely was like a little extra energy, but I think definitely felt like super functional. I didn't feel like there was any kind of limitation in anything that I could do. If anything, I felt maybe a little bit heightened rather than anything negative at all. And so the main thing I've noticed, this will be my third treatment in a week, is actually my sleep. And so that's interesting. I track my sleep and I focus really on like getting great sleep and being very high performance. And I've noticed that all my nights of sleep since this have just been really like fall asleep straight through, like very good restfulness, good sleep scores, like on my Aura ring. And so it's very early in the process, but I've been really excited by that because I didn't really see much about that in like my reading or whatever. And I mean that's a huge benefit, right? Everyone wants their surgeon to be well slept and really dialed in while they're taking care of them. So I really appreciated that benefit. So we'll be depressurizing. I'll give you one more quick update as we exit the chamber on how that goes. And thanks for joining me. Okay, so I just finished my hyperbaric treatment. We powered down. We're at 0, and as it's coming down to 0, the door's lifted away. So now we can actually see. We can see a gap where the door is. So it's totally like depressurized, and I just or the person who's helping me, door just slides open like that. So remember, we couldn't do this before because of the pressure inside the chamber. And so most important thing is we are stepping over like a little bit of an oxygen heater thing. So we're just going to get a good arm hold, make sure we don't hit our head. Come on out. And that's it. Disco. Change our clothes and off we go. Thanks for coming along.